But here's the cliff. And it's funny, when I was trying to find pictures of a woman on a cliff, I couldn't find any clear pictures on the internet. And I was kind of frustrated, so I threw the slide in thinking, I'll just put that in there till I find a clearer picture. And then I realized they're not clear when they're on the cliff. There's nothing clear about being on that cliff. It's foggy, it's scary. And so I decided that that was divine intervention and I should probably leave it in there. So here's a way to be on the cliff, hanging on for dear life. Not really the way that you want your patients to feel after they've just completed their treatment. We want them to be empowered. We don't want them to be fearful. I want my patients to jump off the cliff going for the gusto. And the harsh reality of Western medicine is, we focus and focus and focus on curing the disease, on the physical manifestations of cancer. But if we have a patient with stage 1 cancer who has a lumpectomy, they have a sentinel node, they don't need chemo, they get their radiation, and they may only have 5 days of radiation. They may have had accelerated partial breast therapy, so they may have had their cancer treatment in a 3-week period of time. But that patient who has the greatest likelihood of being cured, if she goes home and sits in her kitchen with the lights off, waiting for cancer to return, we've done nothing for her on her healing journey. All we've done is cure the physical manifestations of cancer, but we're leaving her to try to find her way by herself. So this is where the point of transition comes, where survivors become thrivers, where surviving cancer has to shift to the next gear of thrivership. So here's Pam. I look really short. I'm a little vertically challenged compared to her. Pam is a nurse, and I met her on a medical mission. Every January, I do primary care in the Dominican Republic, not because I'm really good at looking in ears and listening to hearts, but my girlfriend Amy drugged me along on one of her passions, which is caring for the Dominican people. And I met Pam 2 years ago. And Pam's sister had been on our mission before, her identical twin sister. And when I met Pam on the trip, we were walking up into one of the villages during lunch. And Pam's telling me her story about her treatment of breast cancer. And she goes, I got my lumpectomy, I had my radiation, I take my tamoxifen, and that's it. I'm done. And I said, well, what do you mean? And she goes, I don't want to talk about it. And I said, well, what did you do for you? Like, how did you help yourself? How did you get through this process? And she goes, I don't know what you mean. I said, well, Pam, I said, are you going back for your checkups and everything and doing all the right stuff? And basically she said, you know what? I put cancer behind me. It's under the rug. I'm not going to deal with it. And I had realized at that point that I was probably put there because she was still living in fear. She was still afraid that the cancer may come back. And so instead of thinking about it, she tried to push it away. And a lot of times you figure out that if you keep pushing things away, eventually they rear their ugly head. It's kind of like one of those subterranean pimples. Like you want to ignore it. You'd like it to not be there. And sometimes it just comes back and explodes. And my poor kids, teenage kids always have these issues. But so do women and men with cancer. If they push it away, it can rear its ugly head and come back. And so what we did with Pam's always afraid of heights. This is outside the resort where we stay. It's actually a very nice place. And you can see, that's my son down at the bottom in the yellow shorts. He comes on the mission with me. But Pam, the kids have been jumping off this cliff for years. And it was kind of funny because I talk about this cliff, and of course there's this cliff. And so this is the literal cliff. And our first year in the Dominican, the parents that were there were like, oh my God, the kids can't do this, it's so dangerous. And it wasn't dangerous because you jump into the water, it's dangerous because the waves come and knock against the rocks. So being the system buster and problem solver that I am, I went to the Ace Hardware up the street, got that yellow nylon rope, tied knots in it so that they could have a very safe egress from the water. So after 2 days there and after a little walk up into the mountains, Pam said, I could never jump off that cliff. And I said, you couldn't? And she goes, no, never. She goes, it scares me. I'm afraid of heights. I'm afraid of everything. So I'm on the far right-hand side. I'm not off that slide. But Pam was there, and somebody caught these pictures. Obviously, I didn't take them because I was in the water. But Pam was on the edge of the cliff, and she'd been on the edge of that cliff for a couple years. Her cancer diagnosis was several years earlier, but she was still hanging on that cliff because she was afraid to live her life. She was constantly afraid and making decisions out of fear. So what she did, she jumped, And she swam, and then she did it again, and then again. And she said, I don't know what I was so afraid of. And she was afraid of living. She said she never felt as alive since her cancer than when she got to that place where she faced the cliff. But clearly, not everybody has the literal cliff, but it's good for slides. So there's choices on the cliff. And whether you know it or not, your patients can sit there on that cliff and be paralyzed with fear. And some of them do what I say, is they put on their game face. They come into the office, and they have their little game face on, and, oh, doctor, everything's wonderful, it's fine. And they're the ones that are usually trying to throw their clothing on so fast that they get out the door, and you can't catch the fact that they're paralyzed. And then there's the ones that free fall. And they're the ones that are very quiet and kind of mousy and held together, and they just want to sit there, and they're just waiting for the next thing to happen, and what's going to happen, and okay, I'm just going to close my eyes and see what happens, and I'll let it go, and I'll fall. But free falling is not good, because you don't always land on your feet. You can land on your head, you can land on your back, and you don't know where you're going to land. So my choice is to teach our patients to put on a set of wings and choose their destination and fly and start that journey of healing. So, here's my definition of survivors. Our patients are survivors, and we are survivors, when the treatments are completed. Because you've done what you needed to do to physically treat the cancer. Patient's life goes back to where it was. But the harsh reality is no one's life is ever the same after a diagnosis of cancer. Our lives are never the same after a huge adverse event. My life was never the same after I lost my brother. But I had choices to make. I could either live in the anger and the sadness and the grief and loss, or I could be empowered to try to make a difference in other people's lives. So patients need to follow up with their doctors. They need to continue their medicines. And when their cancer experience doesn't really impact their life, then they're really not paying attention. So to me, a patient becomes a thriver when the treatments are in the past, and you realize that the future's not guaranteed to anybody. And none of us in this room should have to get cancer to realize that. And my only hope in healthcare someday is that if we all get these lessons and we all figure it out that there's not going to be a need for cancer, because it's a lesson that nobody ever wants to get. And to me, thriving comes from being present in the moment. And how did I ultimately learn how to be present in the moment? My girlfriend Lauren, the one that was diagnosed with brain cancer, she had surgery, chemo, radiation. Of course, she's a doctor, so she necrosed her bone flap, spit her sutures, had every complication under the sun. But Lauren was told initially she had 18 months to live with her highly aggressive grade 3 astrocytoma. And it's 14 years later, and she's alive. And she's amazing. And when she got seizures last year, she called her oncologist at Hopkins and said, hey, listen, I got seizures. He goes, Lauren? He says, you're an anomaly. He goes, I don't know why you're still here, but I'm really thrilled that you are. And he said, so you're N of 1, and I can say honestly that I can tell all my other patients now when they're 14 years out, they might get seizures. And so we had to switch her medications, and Lauren's getting married again in November, and it's wonderful, and she's fabulous. And she was one of my greatest gifts of teaching me what my patients need. When Lauren was diagnosed, she chose to find healing not only in what Western medicine was offering, but what her friends and colleagues had opened her up to. And Lauren did all of her prescribed therapies. She did the surgery, she did the PCV, she did the radiation, she did everything. But what she also did was she was open to this Eastern healing modality called Reiki. And I didn't know what it was. And she said, listen, I want you to try this, it's very cool. It's a Japanese form of energy healing, and it's about being a conduit for universal energy. And I said, Lauren, I have a big backyard, I Reiki my leaves, I don't know what you're talking about. And, you know, I'm the surgeon, I'm that left-brain surgeon. And so, because I'm a surgeon, instead of actually going and experience it, I just said, oh, let me learn how to do it. So I signed up for a course. I signed up for a level 1 Reiki course. And it was probably one of the greatest gifts I ever gave to myself, because what Reiki did for me was made me realize that if I don't stop and become present in each and every moment, I'm missing an opportunity to connect with my patients, to connect with my family, and to really have that focused intention for the highest healing intention of each and every individual. And it also allowed me to get to a place where I knew that even if I couldn't cure someone's cancer, I can help them along the way on their process.